Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Which of the following laboratory findings suggest possible allergic bronchopulmonary aspergillosis in a patient with asthma? A. Serum IgE level greater than 1000 international units per ml. B. Positive serum galactomannan. C. Intracavitary mass with air crescent sign on chest X-ray. And D. Plateau pattern on the expiratory limb of the flow volume loop. And the answer is A. Serum immunoglobulin E level greater than 1000 international units per ml. In allergic bronchopulmonary aspergillosis, ABPA, there is an intense type 1 immune response to Aspergillus colonization of the airway. It's characterized by a very high serum IgE level, often greater than 1000 international units per ml, with a normal range of 0 to 100 international units per ml, and tissue and peripheral blood eosinophilia. Deep tissue invasion by the fungus does not occur. Galactomannan levels are normal. The air crescent sign, that is a crescentic rim of lucency surrounding a mass contained within a cavity, is a radiologic finding in aspergilloma or other mycetoma. A plateau pattern on the expiratory limb of the flow volume curve suggests expiratory upper airway obstruction, as might be seen in vocal cord dysfunction syndrome or tracheomalacia. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.